Good morning. My name is Kanaparthi Bhuvana Dedeepya, studying second year medicine September batch. Today I am going to examine musculoskeletal examination on Rajaratnam, 45 years old man. Wash or sanitize your hands before examining the patient. Begin the examination by assessing the temporomandibular joint. Place the tip of your finger in front of the tragus and ask the patient to open and close the mouth. Your fingertip should drop into the joint spaces as the mouth opens. Check for a smooth range of motion. Palpate the muscles of mastication. Ask the patient to demonstrate a protraction retraction by turning the mandible forward, lateral, and side to side motion. Begin by inspecting shoulder and shoulder girdle anteriorly. Inspect scapula and related muscles posteriorly. During both inspection, note any swelling and deformities. Palpate for any tenderness at the sternoclavicular joint, tracing the clavicle with your fingers laterally. From behind, follow the bony spine of the scapula laterally and forward until it becomes the acromion, the summit of the shoulder. From there, palpate the acromial joint and from there down to the coracoid process of the scapula. Palpate the greater tubercle and the bicep tendon in the intertubercular groove, checking for tenderness. Also lift the humerus posteriorly so you can palpate over the subacromial bursa and the subdeltoid bursa and the underlying. Palpate the sit muscles. Action where the patient raises his arm in front and overhead. Extension, he moves his arm behind. Abduction, raises his hand out to the side and overhead. Adduction, crossing an arm in front of his body. Internal rotation, placing a hand behind his back to touch his shoulder blade. And external rotation, rotating an arm forward the ceiling from shoulder level. Crossover test. For aptly scratch test, the patient is going to try to bring the hands together on the back, while one hand comes from the above and one from the below. Repeat with the switched arms while looking for differences. To perform knee test, the patient in sitting position and use one hand to stabilize the patient's scapula, then bring the arm into maximal passive shoulder flexion. Hawkins-Kennedy test. Drop arm test. Empty can test. Complete wrist and hand examination. Check for any deformities in the movements. Test for hand grip strength. Finkelstein test. Thumb abduction. Tinel sign test. This is Phelan's test. This is complete knee examination test. In this video, I am going to examine the knee. Bull's sign. This is going to be a patellar tap test. This is valgus stress test. I am going to demonstrate varus stress test. Now I am going to demonstrate anterior Dryer's sign. Luckman's test. Posterior Dryer's sign. I performed all the musculoskeletal examination on Rajaratnam, 45 years old man. He is perfectly alright. Thank you.